Hello friends, welcome to my new video. So today in this video, I'm going to discuss with you all about retinal detachment. Okay, so let's start. So before going to the discussion on retinal detachment, first of all, we need to know that what is retina. So retina is the photosensitive layer which is present on the back surface of the eye, which convert the light rays to electrical signal and send it to the occipital cortex via the visual pathway so that you can see things clearly. So retina is having several abnormalities, like several diseases on retina is there, and one of them is retinal detachment. So from the word retinal detachment, so you can understand that detachment means separation. Okay, so separation of the retina. So separation from what? So what is retinal detachment? It is the separation of retina from retinal pigment epithelium. That means neurosensory layer of the retina get detached from the retinal pigment epithelium. That is retinal detachment. That you can see in this picture, the neurosensory layer is getting detached from the retinal pigment epithelium. So there is some symptoms of retinal detachment that a person can feel, and it can be a triggering factor that the person might have retinal detachment. So first of all, the first symptom will be floaters. There will be appearance of floaters is there. So if the person is having floaters suddenly and it is increasing day by day, then it can be a cause of retinal detachment. Or another, it can be flashes of light. If the person is having flashes of light along with floaters, then most of the cases it is only due to retinal detachment. The person can have flashes of light and floaters. And lastly, if the person is having a curtain over his eyes, there is a black curtain, so it indicates retinal detachment. That is the surety of retinal detachment, okay, that the person is having retinal detachment. So these are the symptoms that can be that can trigger, or that can be the triggering factors of retinal detachment. Okay, so there is three types of retinal detachment. That means there is three ways retina can get detached from the retinal pigment epithelium. First of all, uh, a tear or a hole can lead to retinal detachment. How? That I will discuss in the later slide. Traction. Traction on the retina also lead to retinal detachment and exudative retinal detachment. From this exudative, you can know that there is some fluid is there. Exudates means accumulation of fluid. Okay, that I am also going to discuss in the later slide. Let's start and let's discuss one by one. So first of all, let's start with rhegmatogenous retinal detachment. So what is it? So here in this picture, you can see that there is a tear on the retina is present. Okay, so this rhegmatogenous retinal detachment is due to tear or hole in the retina. So from this tear or hole, vitreous get inserted, and this vitreous helps or this vitreous make the retina to detach from the retinal pigment epithelium. Okay, so here you can see that there is a giant retinal tear is present, so that the vitreous can get inserted to this hole or space, and after that the retina will get separated from the underlying layer. Okay, here also you can see this is a typical horse show tear is present. This is called horse show because it's look like a horse shoe. Okay, so what causes rhegmatogenous retinal detachment? So there is several causes is there, but most common cause is myopia. So this is the picture of a myopic fundus. So the definition of myopia that we get in book, that if the axial length of the eye is more than normal, that is the normal axial length is 24 millimeter. So if the axial length is more than normal, it can be 25, 26, 27, 28. Then the light rays will get focused in front of the retina, so that the person will feel difficulty to see the distant object. So myopia is also known as nearsightedness. Okay, so here due to elongation of the eyeball, the retina gets stressed out, and if the myopia is higher, like more than -10, -12, -15, then it leads to very thinning of the retina, so which ultimately leads to tear on the retina, and that tear can lead to retinal detachment in the later stage. Okay, so here you can see that there is lines are written, that means I can see, so it is due to thinning of the retina. Okay, now we move to tractional retinal detachment. So this word traction you can understand traction means a pull. Okay, so it is when a scar tissue or other tissue grows on your retina and pulls the retina from the layer underneath. Okay, so this tractional retinal detachment is very common in diabetic cases, where diabetic retinopathy cases tractional retinal detachment is more seen. Okay, so here you can see that there is a traction on this area, so that due to this traction, retina is getting detached from the retinal pigment epithelium. Okay, so in diabetic cases, in the late stage, that is the proliferative diabetic retinopathy, due to this neovascularization, sometimes this neovascularization also grows on the vitreous also, and it also lead to several types of scars also there. So it ultimately pulling the retina. Okay, so which leads to retinal detachment. So this is the view from the fundus photography. Okay, so this is the OCT picture of tractional retinal detachment. So here you can see a clear tractional force or pull over this area, so that retina get detached from this base. Okay, so here also it is also tractional retinal detachment. So I put several pictures so that you can understand what is the tractional retinal detachment and how it looks like. Okay, now let's move to exudative retinal detachment. So this word exudative, from this word you can understand there is some exudates. That means accumulation of fluid. So which fluid? From where this fluid coming? Okay, so this fluid is from any inflammation on the underlying layers like choroid. So if there is any choroiditis is there, it leads to accumulation of fluid underneath the retina, which push the retina forward and retina get detached. So here you can see there is no tear or hole, but the color is abnormal color. Normally the fundus color is reddish yellow color, but here you can see a grayish color is present. So this grayish color is due to the accumulation of fluid. Or another reason can be if there is any presence of choroidal tumor is there, then this tumor also leads to accumulation of fluid underneath the retina, which ultimately leads to retinal detachment. Or in case of pan uveitis also exudative retinal detachment is seen. Okay, so what are the management? So here sorry for that mistake that I didn't the full name of rhegmatogenous is not written here, but it is rhegmatogenous retinal detachment. Okay, so what is the management of rhegmatogenous retinal detachment, that I will demonstrate you. Okay, so let's start with this tool. That suppose this is the cornea. Okay, and this is the lens, and this is the retina. Okay, so, let's make the retina nicely. Okay, so in retinal detachment, what happened is that uh, suppose this is the detached retina. Okay, so our aim, what is our aim? Our aim to attach the retina again. So for that, what we need to do? We need to push this retina to backward. Okay, and uh, push the sclera forward, so that these both can get attached together. But we cannot do it directly, so we will do indirectly. Okay, indirect procedure we will apply. So what indirect procedure? So for this purpose we use air bubble or gas like SF6 or C3F8, or silicon oil insertion is there. You also heard about this term, that oil is getting inserted to the patient eye. So what this oil or air bubble is doing? So suppose you are inserting air bubble to the patient eye. Okay, so you will insert that air bubble from this pars plana, and here you spread the air bubble over here. Now that this air will expand from this direction. Okay, so due to that expand of the air bubble will move the retina backward. Now to move this sclera forward, what we need to do is that we need to place a band over the eye, so that that band will move the sclera forward. Now, that is also known as band buckling. Okay, so that band will move the sclera forward, and air bubble will move the retina backward. So ultimately, this the sclera, that means the choroid, because the sclera is moving the choroid. Okay, choroid is moving the RPE layer, and retina is moving backward. So RPE and retina will get reattached. So why it is important? The aim is to attach the neurosensory layer with the RP, because the main source of nutrition comes from the RP layer and also oxygen. So for that purpose, it is very important to reattach the retina again. So this is why it is done. Now suppose this retinal detachment is due to a hole or tear. Okay, so let's make the hole like there is a hole, there is a hole. So due to that hole, retinal detachment occur. So for that purpose, in between this layer, there is accumulation of vitreous. So first of all, before inserting the gas, first of all we need to remove the vitreous. So that is done with an injection. Okay, the fluid inside this space is fluid inside this space will get removed with the help of an injection, and after that the air bubble is inserted and band buckling is also done to make the retina reattach and to fill this hole on the retina to avoid further RD in the future. There is a laser light is used. Okay, and laser is used to coagulate this area and this area. Laser is used. Okay, and this laser will fill the holes. Okay, so this is how RT surgery is done in case of regorgetogenous retinal detachment. Okay, now in exudative retinal detachment, I wrote this is treat the cause. That means I told you that exudative retinal detachment is due to it can be due to choroiditis or panuveitis. So treat that cause, that treat the choroiditis or panuveitis with the help of those steroid medication. So after you treat the cause, the detachment will get easier to treat. Okay, so when you are not treating the cause and trying to treat the retinal detachment, it will not treat. Okay, and tractional retinal detachment, like in case of diabetes, mainly tractional is happening. So in case of I wrote this pars plana vitrectomy because the due to the scar formation, vitreous is now pulling the retina. Okay, which is uh, the main reason of retinal detachment. So pars plana vitrectomy is done to remove the vitreous and place the vitreous with the same index and solution on in that, so that the shape of the eyeball will maintain. So this is how pars plana vitrectomy is performed. Okay, and by performing it, we can easily treat this tractional retinal detachment. Also, in case of tractional retinal detachment, PRP laser is also used. Okay, pen retinal photocoagulation. Now, this is a fundus picture. Here, I will show you how this laser is working. So, how these lasers are spotted here. Okay, so here it is. I shown you that this is a tear or hole. Okay, in the retina. Now, in the for the treatment purpose, what you need to do is that you need to place the laser. You can increase or decrease the um, what to say spot size. Okay, and after that put the laser over here in the surrounding area like this, and if it is needed, then another line is again uh, put it, and if it is very needed, then extra row also can be given like this. Now after plotting the laser light over this region, there is a chance of retinal detachment from this area. Okay, so you need to put the retina laser to this area. Now uh, this area have also the chance of RD. Again, you put it like this and here like this, but the examiner will also put the laser over the edge of the uh, hole to avoid any type of accumulation of vitreous over this thing. Okay, so that they are preventing further damage. Okay, so another thing that need to remember is that the vision that the patient lost during this whole period is lost forever and it cannot be regained, and the remaining vision that the patient is having uh, by doing that surgery, the consultant, retina consultant is saving that vision. Okay, so that's all friends, thanks for watching, and please don't forget to like my video and subscribe to my channel. Please don't forget to hit the bell icon so that you will get notification whenever I upload a new video, and I hope I make you learn something new. And if you learned something from this video, please don't forget to put your suggestions in the comment box. Okay, thank you so much.